I think it's a good idea to come essentially anytime you are experiencing symptoms of allergies that are not able to be controlled in the fashion that you want them to be controlled in, or as easily as you want them to be controlled necessarily. People will frequently try over-the-counter medicines. They understand that allergies are common, they know what the symptoms are, and they're feeling bad, and they'll try some over-the-counter medicines maybe at the recommendation of urgent care or their primary doctor. Certainly, if you get to that point and your medicines aren't working and you're taking multiple medications every day, or at least for several months of the year every day, and your symptoms aren't controlled, certainly that's a time, but you don't have to wait that long. There are options for allergy treatment out there that allow you to be around the things that you're allergic to without having to take a bunch of medicine, even if it's only mild or moderate allergies. And lastly, the age sort of matters as well to some degree. In kids, I would tell you to wait even less length of time, because there are treatments out there that give people long-term control. So if you have a young person who's suffering and you don't want to have to take medicines for decades or many years at least, or however long it is, and you want to give them some relief from that for a long period of time, there are things that can be done for that. So certainly you don't have to wait until you're feeling terrible. Certainly you don't have to wait until you've exhausted every single option. But most of the time people have tried at least a few things and say, hey, I've done this and this, and it's just not, I still have these symptoms. Allergies affect just about everything in our head and neck. It's when you go to learn about this stuff in conferences, they call it the unified airway scenario. The lining of our nose is connected to the lining of our throat, which is connected to the lining of the tube that goes to your ear, and the lining of your ear canal. It's all connected, all your sinuses. And so your allergy issues do typically cause several problems beyond just the itchy, watery eyes, runny nose, sneezing commercials that you read about, or hear about, every spring and fall. In ENT, we very much treat allergies in the mindset of treating the whole person from a head and neck standpoint, for that matter, because treating people's allergies significantly improves their sinus problems and their ear issues, whether they're adults or children. And so there are ways of getting at other people's complaints elsewhere by treating their allergies. The allergy treatment that we provide and getting those under controls had saved thousands of sinus surgeries since I've been here. And we've done little studies on that to look at those things in our patients, because as soon as you treat their allergies, all of a sudden their sinus issues dissipate to the point where maybe they still have occasional issues, but they certainly don't want to have surgery on it anymore. It's not even near bad enough to do that, or they don't have any. But it can affect your ears, it can affect your throat. In young kids, we'll see it with postnasal drip and chronic cough, even essentially. So more recently, even kids who have issues with snoring too loud, potential sleep apnea, one of the main reasons we take out tonsils and adenoids. In the last few years, we found out that treating them with 2 allergy medicines for 6 months, they got to be specific allergy medicines, can actually prevent them from having their tonsils and adenoids removed and actually cure their sleep apnea. So there's lots of things that are beneficial from treating allergies, other than just the typical things you see on the commercial with the flowers and the bees. So we always start with avoidance, right? I mean, if you had a singular thing that you were allergic to that could be avoided, then all you would have to do is avoid it. And so in Iowa, and with majority of our allergens, that's not possible. When you think of things like corn smut and corn, even Timothy and Johnson grass, the pollen gets in the air, tree pollen, it gets in the air, and so it's all around. It's hard to avoid completely, that's for sure. Even things like cats is almost impossible to avoid. We test everybody for cat, even if you don't have a cat, because cat is one of the most potent allergens in the world, meaning small exposures lead to big symptoms. And cats have 2 kinds of allergen that are around they're sticky. They're on backpacks and shoes and clothing. So even places that have never had a cat in them will very frequently have cat pollen in there. So it's just hard to avoid. If you can't avoid it, it's great, but it isn't feasible for the majority of allergens. Then there's over-the-counter medications, antihistamines, nasal steroid sprays, and there's its own class of medicine out there, which most people, if you've you're familiar with it, Singulair or Montelukast. It's sort of its own class of medicine. But there's lots of different nasal sprays which are now sold over the counter, Flonase, Nasonex, Nasacort, and there's lots of different antihistamines which are sold over the counter, Zyrtec, Claritin, Allegra, or just to name a few. Then you try those medicines, usually in combination. Usually people are taking one of each or a couple of each. And so after that, you get to immunotherapy, allergy shots or drops. So what I say to people a lot, because a lot of people will come in and they're trying to be good about their health and they don't want to take medicines, and everybody wants to take the least amount of medicine required to live the life that they want to live. That's absolutely the goal all the time. What I tell them with immunotherapy is it's actually not medicine. I mean, you can think of it, we're using things you're allergic to, natural substances that you experience exposure to every day. We just put them in a vial in a very small amount and repeatedly expose you to it so that your immune system learns not to react to it. That's essentially what it is. So there's not any antihistamine, there's not any steroid in it. It's not anything foreign that your body isn't being exposed to anyway. We're just doing it in a controlled setting to get the response that we're looking for. And that can be done with allergy shots or drops. Allergy shots is exactly what it sounds like. It's a little shot that you get every time. It's a really small needle. It's not too big of a deal. I've had them do it to me just so I don't have to get them, but I've had them do it to me so I knew what it was like. And then there's drops, which you can put under your tongue as well. The biggest difference is their convenience, probably. Allergy shots you got to come in once a week for the first couple of years. As time goes on, you don't have to come in as often, and even theoretically might not have to come in to get them, depending on the scenario. But initially, it's not super convenient for a lot of people to come in every week. And so that's why drops were made. Drops were made for convenience. They may not work quite as well as shots do all the time, but they're really good. I have hundreds of patients who use them, and they love them. But they're convenient because you can do them at home. You do them under your tongue. It's every day. You don't have to come in to have it done. Probably the biggest issue with the drops is that they're not covered by insurance most of the time, so payment can be an issue for that. But at least you have options. You can do either one. What I describe to my patients is this is not a treatment for today. Immunotherapy. I'm talking about allergy shots or drops now. Medicines treat you day to day, and there's no end in sight. They don't actually change your allergic reaction. They simply treat your symptoms. And so the use of medicines is essentially indefinite. We don't know when you will need them, when you won't, essentially, how long you'll use them, how many years. Immunotherapy, allergy shots or drops, is a treatment for 4 to 5 years, typically, both of them. Either one is 4 to 5 years. What I was alluding to, what I say to my patients is immunotherapy, however, is not a treatment for today or tomorrow or next month. It's a treatment that takes a while. The benefit of immunotherapy is the long-term symptom control you get from it and getting off your medicines, which almost always happens. The first time people start to notice effects on immunotherapy is probably around 6 to 9 months. Sometimes people notice them sooner if they had some milder allergies, things like that. But it can be up to a year and a half before they notice significant symptoms or significant improvement in their symptoms. But the total process is 4 to 5 years. But during that process, not only are their symptoms improving, generally more symptoms than they ever expected, but their allergy symptoms for sure, and maybe their sinus problems and other issues, but they're also getting off their medicines. We're slowly coming off all their medicines. And most of the time, unless you have asthma is a little bit of a disclaimer because sometimes they have to continue treatments for that. Most of the time, they can get off all their medicines. And then once you've gotten off all your medicines, we spread out your shots. Once you've gotten to 2 weeks between shots or even longer potentially, and your symptoms are controlled, then we stop. And most people will get 4 to 5 years on average of improvement in their allergy symptoms without having to use a bunch of medicines for at least 4 to 5 years after they're done.